All of the following medications are considered first-line treatments of absence seizures except dash. A. Valproic acid. B. Ethosuximide. C. Lamotrigine. D. Carbamazepine. The answer is D. Carbamazepine. The most commonly prescribed medication for absence seizures is ethosuximide. Lamotrigine and valproic acid may also be used if seizures are unable to be controlled with ethosuximide. Carbamazepine, a common medication prescribed for simple and complex partial seizures, is specifically contraindicated in absence seizures. A patient is hospitalized for alcohol withdrawal and is started on medication to prevent complications from withdrawal. Which type of medication is used to attenuate the possibility of seizures during this hospitalization? A. Benzodiazepines. B. Typical antipsychotic. C. Atypical antipsychotic. D. Selective serotonin reuptake inhibitor, SSRI. E. Antiepileptic drug, AED. The answer is A. Benzodiazepines. Benzodiazepines are the mainstay of treatment for alcohol withdrawal. Antiepileptic drug, AEDs, are not to be used during alcohol withdrawal, and are reserved for patients who have a true seizure disorder. The Clinical Institute Withdrawal Assessment for Alcohol, CIWA, protocol is used as symptom-based therapy with benzodiazepines to prevent seizures and other complications from withdrawal. Which of the following is the first-line treatment for cauda equina syndrome? A. Surgical decompression. B. Physiotherapy. C. Chiropractic manipulation. D. Muscle relaxants. The answer is A. Surgical decompression. Cauda equina syndrome is a serious condition in which the cauda equina is disturbed within the spinal cord, generally due to impingement, trauma, local lesion, or compression. The first-line treatment is surgical decompression. Neither physiotherapy nor muscle relaxants would address the cause of this condition, and chiropractic manipulation may actually exacerbate the symptoms. A client admitted to the neurointensive care unit is having his level of responsiveness assessed by the nurse on duty. Her findings include eyes opening to verbal command, is disoriented but can converse, and obeys commands. What is this client's Glasgow Coma Scale score? A. 12. B. 16. C. 8. D. 13. E. 15. The answer is D. 13. The score of this client includes, eye open response is a 3 out of 4, best verbal response is 4 out of 5 and best motor response is 6 out of 6. An unconscious patient exhibits stiffly extended arms that are also adducted with the wrists hyperpronated. The nurse recognizes this presentation to be dash. A. Least rebrate positioning. B. Vestibulospinal reflex. C. Crossed extensor reflex. D. Decorticate positioning. E. Babinski reflex. The answer is A. Least rebrate positioning. Least rebrate positioning is an involuntary response of abduction, extension, and hyperpronation of the upper extremities due to noxious stimuli. There also is hyperextension of the lower extremities and the feet are plantar flexed. Decorticate positioning involves mommy-baby posture, elbows, wrists, and fingers flexed, and legs extended and rotated medially. The Babinski reflex involves the extension of the big toe following stimulation of the sole of the foot. The crossed extensor reflex is also known as the withdrawal reflex, which involves the differential flexion and relaxation of muscles in the withdrawal of a limb. Vestibulospinal reflexes involve the use of vestibular organs and skeletal muscle to maintain balance, posture, and coordination.